Last night, we told you about the shortage of family doctors in this province. Tonight, we're looking into possible solutions to that problem. Now, one idea involves other health professionals taking some of the workload off the existing crop of family doctors. Senior reporter Michael Crawley has the story.
Okay, deep breath in and out.
Marak Fazal is not a family doctor, but she can do just about everything that a family doctor can.
Great blood pressure.
She's a nurse practitioner.
Nurse practitioners can diagnose, we can prescribe, we can send you to a specialist if necessary.
At this clinic in the northwest corner of Toronto, nurse practitioners lead a team of healthcare professionals caring for hundreds of patients like Andrew Lawrence.
And I've been getting great treatment from Zarna, very thorough, very detailed, and I feel looked after.
We have a dietitian, we have an RN, we have a social worker. And the idea, of course, with team-based care is to be able to wrap around services for individuals that are in need.
There are 26 nurse practitioner-led clinics around the province.
And this just shows me your oxygen levels and your heart rate, okay?
To cope with the shortage of family doctors, Danae Peart believes there should be more.
We're in an aging society, and in this aging society, doctors will retire. And we're not able to replenish doctors fast enough to respond to the needs in the sector.
Across the city, that push to entice new doctors to practice family medicine is intense.
So we have found over the past 1 to 2 years it has been extremely difficult to recruit new doctors to join our clinic.
It used to be common for medical school graduates to train here as family medicine residents.
And that's been a pipeline for us to have new doctors come in and join and allow the practice to grow. In the past couple of years, that's completely dried up.
Across Ontario, the proportion of med school grads choosing family medicine is dwindling.
So we have no new residents who are interested in coming. You know, we've had advertisements and sort of used all of our different tools that we use to try and recruit new doctors and have found it really, really difficult and basically impossible at this point.
How to make family practice more attractive to med school grads? One idea is to team them up with other health professionals.
So we know doctors are stronger when they work in teams. They can have a psychotherapist on their team, even a pharmacist on their team, a nurse practitioner, a physician extender of some sort of physician assistant. And so putting family doctors inside teams to support them will help retain and recruit more doctors.
I believe that we will, as we get wiser in the sector, realize that having multiple professionals, multiple disciplines in the same space, looking out for patient care, we will realize that it's actually the best way.
Mike Crawley, CBC News, Toronto.